Case 4. A 27-year-old man with little prior medical care was brought to the emergency department because of chest pain followed by sudden collapse. Resuscitation attempts were unsuccessful. On autopsy, he was found to have thick atherosclerotic plaques in his arteries, including the coronary arteries, aorta, and renal arteries. He also had small, raised yellow-brown lesions on the extensor surfaces of his arms. What is the most likely diagnosis? This patient had familial hypercholesterolemia, or FH, an inherited disorder characterized by extremely high serum cholesterol levels. Type 1 familial hyperlipidemia is caused by lipoprotein lipase deficiency and results in abdominal pain, xanthomas, and hepatosplenomegaly. Here you can see an example of xanthomas in a child at a hospital in Iran. Type 3 is caused by a defect in apolipoprotein E2 synthesis and results in palmar xanthomas and tubereruptive xanthomas. Type 4 is caused by increased very low density lipoprotein or VLDL production and decreased elimination. What is the genetic pattern of this condition? FH is inherited in an autosomal manner. Heterozygotes typically have high cholesterol, approximately 370 milligrams per deciliter, and are at increased risk of myocardial infarctions. Homozygotes frequently have extremely high cholesterol levels, up to 1,000 milligrams per deciliter, and frequently die before 30 years of age from cardiovascular disease. Normal total cholesterol is less than 200 milligrams per deciliter, and levels of greater than 240 milligrams per deciliter are considered elevated. What is the molecular basis of this condition? In FH, there is a mutation in the LDL receptor gene. This results in a smaller number of functional LDL receptors. Normally, LDL circulates in the blood and binds to its receptor on hepatocyte membranes and is then taken up into the liver and metabolized. In FH patients, LDL is taken up by the hepatocytes less efficiently, leading to elevated LDL levels in the blood. What would the microscopic examination of the lesions on this patient's arm show? Cholesterol deposits in the skin, called xanthomas, form when there is a persistently elevated LDL level. They are composed largely of lipid-laden macrophages. Statin drugs are frequently used to treat this condition. What is their mechanism of action? Statins inhibit 3-hydroxy-3-methylbutyryl coenzyme A reductase, a hepatic enzyme that catalyzes the rate-determining step in cholesterol synthesis. They reduce the amount of endogenous cholesterol synthesized by the liver.